There you go. We can
Okay,
see
so we're ready to go. Yeah?
Yep.
Great. Okay, well, thank you for joining me on this webinar on overcoming health anxiety. My name is Rob Wilson and I'm a cognitive behaviour therapist. And I'm hopefully going to show you a few ideas on how to at least get started on the process of overcoming health anxiety. Hopefully you can see in front of you an image from the Guardian newspaper from a few years ago, which I think is a typical representation of how people imagine someone with health anxiety, or what was sometimes called hypochondriasis years ago. We have the image of a woman here presenting a list of symptoms to her doctor, and the doctor looking somewhat overwhelmed and overloaded. And in some ways this is important because it highlights that GPs are sometimes overwhelmed by too much information and too many symptoms, and it actually makes it harder for them to make an accurate diagnosis. So a few lines on what actually we're dealing with here, what health anxiety is. It's defined as a preoccupation with fears of having, or the idea that one has, a serious disease.
Rob, sorry, I'm just going to interrupt. I think we're just having trouble seeing your slides. Can you just
You having trouble seeing the slides?
Yeah, we can just see your front slide.
Which slide?
I think we can just see the front, the first slide, the one that just has everything.
You can only see the first slide?
Yep.
Oh, I can see them. Oh dear.
Do you want to just maybe shrink and minimize and maximize the screen again? It should work.
Okay.
Yeah, that's better.
What can you see now?
We can see your full screen now, so that's better. If you just yeah, we can see the right slide now. That's fine.
Okay, shall I just stick with that format then?
Yes, please.
Okay, sure. All right. Just again quickly introduce you to the diagram I mentioned from the Guardian newspaper. Moving on to the definition of health anxiety again. As I said, this is a preoccupation with or a fear of having a serious disease. It's based on the misinterpretation of bodily sensations. The idea that, for example, misinterpreting tingling in one's hands as being an example of having MS or something. But importantly, that this belief isn't completely and utterly fixed, as it might be in a problem such as schizophrenia. And it's not about appearance, which we would call body dysmorphic disorder. And importantly, that we don't just expect people to believe that they've got health anxiety if they haven't been told that the symptom doesn't appear to have a medical cause. But the important criteria here is that the preoccupation with the illness persists even if someone has been reassured by a doctor. And we'll talk a little bit later on about how that might actually be part of the maintenance of the problem is consultations with doctors. Moving on to the prevalence. I've got a bit of a challenge here because I can't see the whole screen here, but accurate estimates of health anxiety are difficult. But it's been estimated that somewhere even as high as 80% of GP consultations may not have an entirely physical origin. We think that people, roughly as many as 2% of the population, have health anxiety, the people that attend a primary care clinic. And importantly, people with health anxiety suffer greatly. And they have high rates of worry and depression as well as health anxiety, and the burden of health anxiety on the healthcare service is significant because, of course, people are attending for consultations about a psychological problem, believing that it's a physical one. Some more of the common features of health anxiety. We already said it's a preoccupation with the idea that one is ill. people oftentimes have an excessive sense of vulnerability to illness. They sometimes feel that they're more likely to become ill to a certain disease, such as cancer or heart disease or MS or whatever their feared illness is. They tend to have an idea that they're more vulnerable to that than the average person. There's often frequent reassurance seeking, often there's checking behaviours, and other safety seeking behaviours such as reviewing information on the internet and taking other tests and so on, tests you can buy from Boots. And often people with health anxiety repeatedly ask for more investigations, want to get to the bottom of it and have certainty that their problem either definitely does exist, or that they want to know for sure they really don't have this problem, that they want to have that certainty. Psychologically, often people with health anxiety tend to be excessively responsible for their health. We know, for example, the average male is a bit under-responsible for his health, and we can't get them to GPs enough, but people with health anxiety tend to really feel the burden of being responsible for their health rather greatly. There's often a fear that individuals might miss something important if they ignore bodily sensations, and sometimes that even that being will cause harm. So that people then might accept that they've got an anxiety problem, but then go on to worry that anxiety itself is going to cause them some kind of ill health. And sometimes people confuse health anxiety and panic disorder a bit, partly because they both involve a misinterpretation of bodily sensations, but the difference really is in how quickly you think that the problem's going to result in some form of catastrophe. So in the case of health anxiety, if a person notices a heart arrhythmia, they might think, eventually I'm going to have a heart disease and this might make me very ill and I might die too early and leave my children behind and things. Whereas someone with panic tends to think, if they notice a heart arrhythmia, oh goodness, am I having a heart attack right now? I might die right now. So the catastrophe is very immediate. So as principles of self-help, a lot of these we've included in our book, Overcoming Health Anxiety, written by myself and Dr. David Veal, which is part of the Overcoming series by Constable Robinson. And there is a lot of information in that book and some useful questionnaires and measures. David's written an excellent chapter in there on death. In his usually slightly outrageous style, but it's very, very useful as well. And so many of the topics I cover today will be expanded and covered in more detail. General principles, though, of CBT, cognitive behaviour therapy, are really along the lines of really we're as anxious as we think. So if we interpret something as more dangerous than it really is, we're going to feel more threatened and therefore more anxious. And therefore, becoming less anxious involves considering a less threatening alternative interpretation. And that this interpretation has to be a credible one. So it can't just be something like, oh, you've got a deficiency in a certain mineral, which may not map onto your experience. It needs to be something which is credible and survives past, present and future experience. So here we might think of alternative explanations as that the reason I'm having the idea that I'm ill is a product of my tendency to worry too much about my health, and that alternative interpretation may well be more credible, and it's something that you can put to the test. I should say the numbering and the funny squiggles down the left-hand side here are something that I've struggled for 10 minutes to get rid of, and I can't, so I'm sorry about those, but I simply can't make them go away. But this is a very broad overview of the kinds of principles of self-help for health anxiety. Crucially, it's really important that you understand what the problem is. So rather than lots of wasted time being reassured that you don't have a particular illness, such as you don't have cancer, you don't have heart disease, you don't have mad cow disease, and so on. The crucial solution to overcoming health anxiety is understanding the nature of the problem. So it's the same as solving any other problem. You really need to know what the problem is and how it works. So step one is really identifying all of your own avoidance and compulsions and the way you may be overly focusing your attention on your body and so on. And then it's really important to normalize the fact that people do have intrusive thoughts about becoming ill. They have images of themselves becoming ill and their family being by the bedside and weeping. But it's about making a decision that you're going to allow these very normal experiences and to tolerate those uncertainties. So once you've only decided, you've understood a bit more the solutions of the problem, and I'll talk a bit more about theory A and theory B in a minute, but theory A really is about, the first theory is I've got a physical problem that I need more information about, and theory B might be that I've got a worry problem that means I've got to learn to worry less. So the endeavour in therapy is to try and keep your eye on how you want things to be different, how you'd like to change and develop, really trying to visualise yourself being psychologically healthier and happier, and focusing on what else is important to you in life in terms of the kind of, maybe the kind of partner you want to be, the kind of parent you want to be, the kind of member of society you want to be, what's important to you in terms of hobbies, interests, exercise, education, the community, and really focus your mind on, instead of being preoccupied with the idea that you're ill or that you might become ill, starting to train your mind into focusing on other aspects of living and really focusing on things that will bring you satisfaction and good mental health. So the first step is to start to intervene with your health anxiety by starting to cut back on compulsions such as checking, bodily checking, or checking on the internet, or checking medical texts, or reassurance seeking. And one really simple but very effective way to help with that is to start to record the frequency. And you can either purchase a little machine called a tally counter, which counts the number of times that you've carried out a certain behaviour when you press the button. You sometimes see these things on with train guards have them as they count the number of passengers. You know, this is what's in walking through the carriage, click, 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 counting up the number of people. And you can use that same little bit of machinery to record the frequency, say, of bodily checking or seeking reassurance, and write the number down in a diary at the end of each day of those particular compulsions. And it's quite helpful because you can then see over time how things are reducing and that your particular compulsions are cutting down. And it's also helpful sometimes to avoid, start to identify the things that you tend to avoid, and start to think about whether you need to start to devise a program of graded exposure, which again I'll talk about a little bit more, but it might be to things like certain kinds of images or illnesses, certain trigger words, it might be particular people, it might be certain situations such as hospitals or GPs, or GP practices. So it might be about identifying things that tend to trigger your anxiety and repeatedly confronting them, much as you would with a phobia, until they produce less anxiety. And really remembering that what you can't do is you can't control the thoughts and the images and the doubts that enter your head. You can only decide what you do once they're there. So one of the other principles to try and make your upsetting thoughts less distressing is to become more distanced from them. And again, I'll talk a little bit more about that. So here we have some catastrophic misinterpretations, which we've said, remember, is the heart of health anxiety. An example here being my heart's pounding, the idea I'm going to have a heart attack, there's lumps under my skin, I've got cancer, tingling or numbness, I've got multiple sclerosis, I've got I have a headache, maybe I've got a brain tumour, or if I've got all of them, maybe I think I'm dying. And these catastrophic thoughts can be about a range of topics, and they can occur not just as verbal thoughts, but they can also often occur as images and pictures in your mind. And sometimes those pictures in your mind are accompanied with real physical sensations, so they can feel very real. So there might be images of dying or being dead. Might be images of being very ill and helpless in a hospital. There might be images of loved ones either standing around a hospital bed or crying at a funeral, thoughts of the afterlife, and maybe an image of sitting on a cloud watching your life pass you by, now you're dead. And there's many others. Your mind has an unlimited capacity to imagine, and that's a great thing. It also has an unlimited capacity to imagine things that are. Rather than having every bodily sensation or every thought or mental sensation corrected or responded to, one of the suggestions we're making is to try and think of your thinking, a bit like 40 steering in a car. So what you imagine is that you're driving along in your car and you're holding the steering wheel straight, but the car is veering off to the left a bit, and to correct the car, to make it go straight, you turn the steering wheel slightly to the right. And this is a bit like understanding how your own thinking works regarding health. If you know that your mental steering, your thoughts tend to lean towards misinterpreting things or interpreting things in a slightly catastrophic way, always assuming the worst, then it makes sense to try and, if in doubt, assume towards the best. So the trick is then to try and generate a general principle that because I know I worry too much about my health, I'm going to consciously try and assume that things are okay. Because I know that's safe for me to do, because I know that my mind tends to assume things are not okay too easily. So the sensible thing to do is to assume that things are okay, just lean towards that a bit more. And that has to be done without constant proof or certainty, because again, your body is a multifaceted thing. Your mind has an unlimited capacity to generate doubts and thoughts. And really what we're saying here is we really want to tackle your health anxiety as the primary problem. And so to really do that, developing a less catastrophic thinking style is really crucial. Is that, of course, getting ill and eventually dying happens to all of us. We'll all get ill at some point in our lives, and we'll all die of something. And that's true of the whole population, and yet most of the population, we've said about 98% of the population, we think aren't that preoccupied with their health. So the fact of the matter is that illness and death is a fact for everybody, but most people don't have health anxiety. So really, it's probably true to say that health anxiety doesn't really have that much to do with the reality of death and dying, because, or illness, because if that were the case, then more people would have it. So a really important question to have is, so what else, if I don't have to solve protecting myself more from certain illnesses, and I don't have to solve what happens when you die, maybe it's really important to start to think, well, what do I have to solve? What aspects of my problem do I need to work on? Because, of course, health anxiety is an extremely upsetting problem, incredibly disabling and distressing. Probably doesn't really receive enough recognition for the really awful problem that is in its own right. It's sort of, in some ways, it's about making a decision. And it's a decision on how am I going to come at this problem? How am I going to treat it? And it's based on this theory A or theory B principle. Theory A being, well, I've got this problem that I might be ill or I might become ill, and that's the problem. Or alternatively, the theory could be that I'm very worried and I'm afraid of becoming and I'm too preoccupied about that I might be ill or I might become ill. And which theory fits the facts best, and particularly which theory is going to be most productive. And something we'll talk about a bit more is that one of the things we're going to ask you to try and do is commit yourself for a period of time to try out treating the problem as if it's one of worry and preoccupation, and steer clear of any further medical investigations or tests or reassurances, and really, really focus on the psychological component. I think one of the things that can help to do is generate a personal image of a way of looking at your health anxiety. So you could think of it as a bully. You can think of it as a bit of a leech. You can think of it as a badly tuned radio, which is constantly putting out threats and ideas about being ill or bad things happening, catastrophic FM. Or you could think of it as a computer virus, something that's got into your mind that's constantly dropping maybe catastrophic emails into your email box. But it's a way of, one of the things to do is try and think of a separation between there's you, the individual, and then there's this problem, health anxiety, which is constantly trying to maneuver you into being preoccupied about your health, focusing on your body, checking your body, seeking more reassurance, gathering more information, going for more tests. You have to think about health anxiety as being this thing that's really just all it cares about is keeping itself alive and keeping itself going, and it has no interest in your quality of life. So people often find it helpful to have a personalised version of this. Think of your own. So a way of understanding what's going on when you've got health anxiety and you're checking and reassurance seeking is that it's like trying to dig your way out of a hole and looking for new tests, new opinions, a better doctor, a more modern technique. It's a bit like trying to find a bigger and better shovel. And so again, this overcoming health anxiety is a decision to put the shovel down and maybe look for a rope ladder or some other tools to get yourself out of it. And clearly, from my point of view, CBT. And people persist with things like checking and reassurance seeking because, of course, they do work to some extent. They tend to reduce anxiety in the short term. And some of them, if people find that if they do a sort of preemptive check or ask certain questions of their doctor, they go very well prepared before they go, that this prevents more doubt and actually temporarily does prevent anxiety from coming up. But oftentimes what happens is that people find that over time compulsions don't work as well, and they have to spend longer carrying out certain checks or certain kinds of reassurance-based conversations. And often what they end up doing is things, because it becomes too time-consuming and too cumbersome to actually go through all the compulsions, they start to avoid triggers more and more. So we've got a key dilemma in health anxiety is this issue of reassurance seeking, and it can be a real problem because, of course, you have to be reassured to know you've got health anxiety because that's part of the diagnostic criteria. However, it can become more of a problem because sometimes when a person goes to a doctor for reassurance and the doctor sends them for a test to try and reassure them, what happens is the person then interprets it and in a certain way and thinks, well, maybe they do think there's something wrong with me, otherwise they wouldn't be sending me for a test. And oftentimes the more doctors you see 10 different doctors, you'll tend to get 10 different opinions or ideas. So it just produces more uncertainty in the long run. And remember, at the heart of health anxiety is the idea that it's a preoccupation problem. And preoccupation really means, of course, it's spending too much time thinking about something. So another way of thinking about what you're doing in terms of what we think of solutions being the problem is that any time spent thinking or talking or researching health actually is just spending more time thinking and focusing upon your health. So it's actually part of the problem, even if the conversation is quite positive. It will mean your mind is spending more time thinking about health, and that's actually going to be fuel to the fire. So trying to spend more time finding things out about health problems is a bit like trying to put a fire out by adding more wood. Einstein says we can't solve our problems with the same thinking we use to create them. And this is important because real change comes from a fairly radical shift. People oftentimes try and solve anxiety problems by partly facing their fears or partly cutting back on compulsions, but at the same time doing a bit of checking and a bit of researching and a bit of information gathering. And that's really not a strong enough treatment to overcome something as difficult as health anxiety. You really need to fully disengage from thinking and focusing and engaging and participating with health anxiety and really fully the process of overcoming it. Trying hard not to think about your health, because then you're into a problem called thoughts depression, sometimes called the white bear effect, and oftentimes therapists talk about the experiment of trying not to think of a pink elephant, and then all you can do is think of a pink elephant. And it's worth remembering that trying to not think about things is a bit like having a volume control on backwards. The more you try not to think about things, the more they'll tend to intrude into your mind. So the crucial thing is about distancing yourself from thoughts and allowing them to pass through your mind. So we have this idea of treating them like mental traffic, just not engaging with the thoughts, not debating them, not trying to work them out, but knowing that because right now I've got a problem called health anxiety, I get quite frequent doubts and thoughts and catastrophic images in my mind about my health, or maybe even the health of people I care about. My job is to just see what happens if I just distance myself from those thoughts and allow them to pass through my mind without engaging, responding to them. Now, I realise that's easier said than done, but it is nonetheless doable. And with practice, people really do get much better at that. And it really is very possible to go to the place where thoughts just enter your head and just let them pass. So a way of thinking about this is there a train going down a train track, or a car going down a road, or a leaf going down a river. They're just an object entering your head, be it a thought or an image, and your job is to observe it, notice it, just to allow your mind to take care of it itself. No need to remove it, no need to debate it, no need to go and find out more information. Dilemmas here is that people often worry that if they start to ignore their thoughts or ignore bodily sensations, that they might live to regret it. That they might become ill and look back and think, damn it, I should have taken more care, I should have really gone to the GP one more time, or I should have gone for another investigation, or I should have checked that mole another time or something. So really what people with health anxiety are most afraid of, I think, is often that place of being in and regretting it. But the thing is, one of the questions to ask is whether if you were being sold an insurance policy that said, okay, I can insure you against that place of regret, but all you've got to do is give me years, the rest of your life, of being very anxious and very worried, a bit distracted, not able to really engage in the rest of your life and really suffer a lot of pain and distress. You've really got to ask yourself whether that's a premium you'd be prepared to pay. So really think about whether the cost of all the suffering that health anxiety causes is worth what it tells you it's going to prevent. And I'm not even sure that it necessarily delivers what it promises. So another technique to help you with overcoming this is to learn to really practice switching your attention. So this is the two techniques called attention training or task concentration training, and it involves setting aside about 20 minutes a day where you decide you're going to deliberately practice refocusing your attention. And one of the easiest ways of doing this is to go for a walk and to pay more attention to the ground underneath your feet, the wind against your skin, the sensation of any other bodily sensations you're getting from the world around you, like rain hitting your face, the smell of the flowers or the rubbish, the sound of any birds or traffic around you, the sky, the trees, the buildings, the colours, and using all of your senses to try and deliberately tune your mind into the world around you, because one of the problems that comes with health anxiety is being overly tuned into your body or your mind. So it's like a physiotherapy. You recognise you've got an overdeveloped self-focus mechanism, and to counterweight that, you're going to really practice training your attention to be more externally focused. And this has been tested as a treatment on its own for health anxiety with quite good effect in Australia. So it really is a good investment to practice switching your attention away from your body so that your mind gets used to not dwelling on what's going on inside of you, but becomes more engaged with what's going on around you. You will recognise the Death Star in the picture there. And one of the things that sometimes happens in images and thoughts about death is that people stop at the most upsetting part, like the image of their family being very distressed at a funeral or something. And sometimes it's helpful to, if you've got an image in your mind of dying or death, sometimes it's just worth considering what will happen over the next few weeks or months or years, or even decades, because it can sometimes help you to, as if it's like watching a horror movie come to a better end. You can't follow the story through to the point at which maybe the family members are recovering and getting on with their lives, for example. About facing your fears, I'm imagining most people will be familiar with the principles of exposure. And the targets in health anxiety are going to be things like, do I need to expose myself to images of death? Do I need to go visit some graveyards? Do I need to expose myself to images of illnesses? Do I need to deliberately provoke my intrusive or catastrophic thoughts and images or bodily sensations so I can get more used to them, or so that I can get practice at allowing them to come up without really paying much attention to them? But the key thing is to really grab life with both hands and to make sure that your health anxiety isn't stopping you from doing anything you want to enjoy. And if there are particular areas of life that your health anxiety is making difficult for you, sometimes it's helpful to then target those deliberately and go practice dealing with. Things to do is to seek some inspiration whilst you're tackling the problem. Sometimes it's helpful to think of inspirational role models, people that you know that have overcome problems in real life, in fiction, religious figures. So sometimes think about metaphors such as being a rock in a river and allowing your anxiety to flow over you. Sometimes it's helpful to really find something that gives you a sense of it's possible to overcome adversity, and really in the process of tackling your health anxiety, that's exactly what you're doing. You have a very real problem and you're going to have to fight hard to overcome it, and sometimes just having some sense that you're not on your own with that, or something that really gives you a sense of inspiration, can be very helpful. So think of what you're doing as retraining your brain and really giving a very different workout, instead of a workout of worry and engagement and trying to seek out certainty, a workout of refocusing attention and tolerating doubts and distancing from negative thoughts and images. I will just, I think, skip to time for questions. So again, we've got good old Albert Einstein here to remind us that doing the same thing over and over again and expecting different results is the best definition of insanity he's ever heard of. So it's really important. What I'm saying is it's time to try something very different. And that even with self-help, without professional help, you really can achieve sometimes really remarkable results. And remember that even if you are seeing a professional therapist, most of the effective ingredient of that therapy will be them setting homework, and you will go off and do it yourself in any case. Really go for it, really go for a complete removal of the health anxiety, and really give it a trial, give it 3 months and a proper go, and just see how it works and really try the techniques out. And you can always go back to the old techniques of reassurance seeking, checking and so on, but it's a really horrible problem, and please do have a really good go at overcoming it. And that's the end of the presentation.
Brilliant. Thank you, Rob. That's really appreciate that. We've got a few questions that have popped up already. Just a reminder to participants, we've got about 5 or 6 minutes, so if you have any more questions, Rob, just type them into the little box on the panel, and I can read them out. We have a question here. I guess it's a kind of a definition. When is being neurotic become having health anxiety, or are they the same thing?
Well, they're not the same thing. I mean, health anxiety is a problem. You wouldn't get a diagnosis usually unless it's lasted more than 6 months, and that health anxiety is much more disabling, so it really interferes with people's lives and really stops you from being able to get on with important aspects of living. So the difference really is very clinically significant levels of distress, and that it really interferes with being able to do important aspects of living like education and work and relationships and so on. So you can be neurotic and kind of get on with life, but health anxiety is a much more serious thing than that.
Okay, thanks, Rob. There's another question here. It says, I don't have health anxiety per se, but I do tend to panic when I get ill. Is mindfulness and distraction the best way to deal with this panic?
At the time, yes. I mean, and a sort of a willingness to experience panic, sort of anxiety, is one of the best ways of avoiding panic, because if you really allow those initial sensations of anxiety to occur and are quite willing to accept them, allow them to just flow, you're less likely to turn them into panic, because really panic happens when you really fight and resist anxiety and you become more and more anxious about being anxious till it reaches this sort of peak of panic. So the early intervention of really normalizing anxiety sensations and allowing them to happen and showing yourself that nothing terrible happens just because you've got some of these bodily sensations is probably the most effective thing to do.
Okay, thanks, Rob. Sorry, there's another question here. It just popped up. It says, is health anxiety more commonly about yourself, or is it also just as common for it to be about someone else?
It's more commonly about yourself, but in my experience, it's far from unusual for someone to be also worried about a partner or a child, someone they love. Usually someone that feels as if they sort of fall within your close personal world. And it can cause a lot of friction because particularly partners get really annoyed at being checked or being hassled to go to see the GP when they're quite happy that things are okay, but the health anxiety sufferer really wants more reassurance. So it's certainly not unusual. And you just treat it in the same way. The same principles apply in terms of cutting back on rituals and more tolerance of doubts and distancing from catastrophic thoughts.
Okay, there's another one here. It says that this person has heard about a technique of spending time just focusing on the anxiety as for like a period of about 45 minutes as intensely as they can. Is that a common technique? Is that exposure?
When you're doing something like that, you normally have a rationale for doing it. So see, the key thing is what you're going to learn from it. Because just focusing on anxiety in itself isn't necessarily therapeutic. Therapy is about, therapeutic use of facing your fears is about bringing in new information and learning or practicing a new skill. So if you're particularly intolerant of anxiety, you need to learn to tolerate it, then that might make sense. But it wouldn't be a treatment for health anxiety on its own, I don't think.
Okay, Rob, there's another question here. It says, I can see fear of vomiting can be separate but also linked to health anxiety. Does it commonly occur with health anxiety?
That's an excellent question. We included a chapter on vomit phobia in our Overcoming Health Anxiety book because we do think that there's a bit of a relationship, and certainly vomit phobia is very underestimated and very under-researched and neglected. And sometimes it links with health anxiety because, of course, people worry that if they become ill, they'll be sick. But it can also, it is often a problem in its own right. And I know that David Veal is doing some research at the moment on vomit phobia, and I think he's beginning starting a treatment program for vomit phobia, since it's a very, very disabling problem. But again, a lot of the principles we'd use to treat health anxiety would also apply to vomit phobia.
Okay, Rob, thank you for that. That's the last of the questions we have. It's very much appreciated.
Pleasure.
And thank you to our attendees as well. As I mentioned before, we have recorded this, so it should be available on the ACD Week website from tomorrow. And thank you very much.
Thanks, Joel.
Thank you.